what is the current gap? What's the current picture that we're dealing with in healthcare, and what are you hoping to fill?
Yeah. So I think the gap is twofold. One is coverage. There's a lot of highly selective practices that you can't get in with for many months or at all, depending on your insurance. And the other gap would be if there's an indication for surgery or not. So a lot of times people are dealing with chronic either overuse or degenerative conditions that aren't amenable to surgery, like things that aren't surgical but still have a lot of need for treatment because they're limited. You can't put your shirt on, can't wash your hair, can't hammer, can't paint if you're in the workforce. When those people fall into that gap and can't find someone with the tools or a team of people with the tools to take care of them, then they often fall into disability or depression or other disrepair in general from the debilitating condition. So for me and you, we can help them as long as they are steered in the right direction with what we do. It's very cool to see how something so simple in a 10-minute treatment can actually change how your body is reacting. And that to me is like that's the key to the future, I think. A lot of these studies happen at the professional level because cost isn't an issue, right? So we see a lot of the NFL players getting these, even in routine knee surgeries. My partners will put in some bone marrow aspirate concentrate and help, because the studies that have been done recently show faster healing. And all of this is to get people back quick. All of this is an effort to get people back to full recovery.
All right, welcome to another episode of the Myokinetix podcast. Today we have a really cool guest. He is a non-op specialist at Academy of Orthopedics, Dr. David Rodriguez. So I'm so excited to have him on, just because we talk back and forth off camera all the time, even via text when we have any complex, chronic injury that, patient last resort is always injury, but he's the go-to guy to actually say, hey, wait a minute, let's not do surgery yet. Let's figure something out. So David, welcome to the show, man.
Thanks for having me. Pleasure to be here. I've been looking forward to this for some time.
Yeah, I'm looking forward to you to share some knowledge what you've been doing, especially dealing with patient who's been through a lot, because like the pain cycle is a real thing, and then once people get into that pain cycle, it's really hard to come out, especially with like relying on pain meds and all that stuff, which does not produce long-term outcome, right?
Right.
So can you give us a little bit of background of how you got into like sport medicine?
Yeah. So, initially it wasn't even intuitive to me. I didn't even know what the field was. All along throughout my career, I wanted to take care of people for a time frame, like not just one visit and see you never, right? So it was seeing them again, making sure they get better with the treatment. So chronic care was always something that came to me. And then, through my shared experiences going through med school, residency, things like that, it just kind of fell into place that this was a perfect option where I could see people over and over, make sure they're getting better, and then also help guide their care, whether that is surgery ultimately or non-operative treatments most of the time, but also looking at their whole person picture. So I'm a medical doctor by training first, so primary care, thinking about all the different ways that your body's affected by disease or injuries. And then after that, sports medicine and non-operative orthopedics. And so I could kind of play in a lot of different modalities that I've trained in. So it kind of just happened, actually. I didn't grow up, thinking I wanted to be this for sure. I didn't know what I wanted to be for a long time, but it's turned out really great. I'm really lucky to have, this opportunity to take care of people like that.
And you grew up in Jersey.
Yeah,
right?
from Jersey, born and raised. First in Jersey City, Hudson County, then moved to Bergen County. So Jersey, North Jersey has always been home. So to be able to go as far as the distance of the Caribbean in Grenada to come back, train here, then leave, go to Ohio again for fellowship, and then get lucky and to come back home and take care of the community I grew up in.
Awesome, man. So when you were obviously picking your specialty, what gear you towards more non-operative rather than a traditional, like orthopedic surgeon route?
Yeah, so a number of things. For me, I was always interested in the medical aspect of things, the physiology, how things worked. So I gravitated more towards medicine rather than surgical intervention. And then I realized, there's this whole subset of population that doesn't need surgery or isn't eligible for surgery even, but we can still do a lot to take care of their pain, help them reach their goals, whether that's athletic endeavors or simply just dancing at, their kid's wedding that weekend. And there is this void that I saw a lot of patients falling into. They can't find a specialist that'll do anything for them, or they went to see somebody and it wasn't a surgical thing, and they said, "Oh, we'll just take some Tylenol and see how you feel tomorrow." And that kind of gap led me to want to really fill after learning about the specialty in general. And so I just kind of went in that direction and got the training I need to come back and, fill the void for lots of people.
Can you just kind of explain to the listener what is the current gap? What's the current picture that we're dealing with in healthcare, and what are you hoping to fill?
Yeah. So I think the gap is twofold. One is coverage. There's a lot of highly selective practices that you can't get in with for many months or at all, depending on your insurance. And the other gap would be if there's an indication for surgery or not. So a lot of times people are dealing with chronic either overuse or degenerative conditions that aren't amenable to surgery. Like, sure, you could operate, but it's not going to make anything better.
Mm.
And more conservative treatment than either primary care or another provider has tried basic stuff, but isn't getting quite the goal of the patient accomplished. And so oftentimes that's chronic tendinopathy, chronic overuse injuries, partial tears, things that aren't surgical, but still have a lot of need for treatment because they're limited. You can't put your shirt on, can't wash
Mm.
your hair, can't hammer, can't paint if you're in the workforce. And so when those people fall into that gap and can't find someone with the tools or a team of people with the tools to take care of them, then they often fall into disability or depression or other, disrepair in general from the debilitating condition. So for me and you, we can help them as long as they are steered in the right direction with what we do. So uh, that's mainly the gap there, and being available and offering them treatments that maybe no one else is either trained to do or
Mhm.
know exist even.
Yeah, I 2 years ago I had an opportunity to go to the UK, and I met with a bunch of physio, and they have nationalized healthcare over there, and I was asking them like, how does it work on their end, and what they explained to me was like, I was really surprised because essentially if you were coming in, let's say with like a knee pain, right,
Right.
and they would just say, okay, well, go to the hospital, and then you're gonna get this sheet of paper of the exercise you have to do, and they're gonna tell you, I take X, Y, and Z medication, and then come back in 2 months, and if it doesn't work, then we'll give you new exercise and then new
Right.
medication. And on average, I was like, when I was talking to some of my peers over there, they're like, we see people nonstop, but they don't get better. And then that's why most of them end up leaving the profession to pursue something else in the UK. So I do see that in the current medical situation as well, where like you've seen it, where like maybe some of your colleagues in med school, they're going through that right now, where they just see patients nonstop,
Yeah,
right?
absolutely. There's plenty of my colleagues that still do primary care and, knee pain, right, or back pain. I tried everything. Well, we need tried everything. Well, I gave them Tylenol, I gave them Advil. I said, do some exercises, and they just keep coming back. Like, I'm so frustrated, not with the patient, but with the situation. I don't know how to help. And often that's when I said, well, why don't you just send them to somebody, send them to me, send them with somebody, that can take it to the next level and see what else is going on there, dig a little deeper, or just use a different set of skills to maybe try something different to break that cycle of pain, get a little bit better, pain, get a little bit better, and then, just slowly degenerate with something like arthritis or something like chronic tendinopathy. So yeah, that's the cycle. And, people get burnt out on both ends, right? Like
Mhm.
a patient will get tired of that and just give up on the medical system and not go to the doctor, thinking there's nothing for them, which in some places, that's unfortunate.
Mhm.
And then on the medical side, providers get frustrated with not being able to help or not knowing what to do, and maybe come off standoffish or kind of fail their patient in that regard.
Yeah, and I do think currently we have so many cool and new technology that we can be excited about, especially from a non-operative perspective. What is something that exciting you right now, like
Yeah.
that you're like just couldn't wait to share with your patient?
Yeah, so there's this whole field of minimally invasive or non-invasive therapeutic options, which you know about too, right? So we got shockwave therapy, which a lot of people haven't heard about, ultrasound guided procedures, injectable options of all different sorts, and then minimally invasive ultrasound guided procedures to actually take out bad tendon or things like that. in a way that's, under local anesthesia, not surgery technically. The recovery is way faster than a major open surgery, for example. But yeah, something that we've been really getting interested in is the shockwave therapy at the national level, at the sports medicine conferences. A lot of hype about it because the studies are coming out and showing a difference, and it's a great option for people who, either medically can't go for some sort of invasive procedure or just don't want to do that yet or aren't indicated for it. And I think it's something that we're going to see a lot of in the future.
Yeah. So I mean, the shockwave is something that when I learned about it a couple of years ago, and I was like, wait, we got to get our hands on this technology. It's just because it has so much upside
Yeah.
potential
Yeah.
for healing, but then the downside is like almost minimal.
Right.
It is almost risk free.
Right.
Almost. Yeah.
Yeah. Yeah. So, the premise of it is simply, shock waves. So you have a handheld device, right? That someone who's skilled in the technique just goes over the problem area and tries to reinvigorate that tissue that's kind of shut down on the patient. Um, a lot of a lot of the problem is linked right back to the anatomy, right?
Mhm.
So tendons aren't very well perfused, in terms of blood vessels going to the area. So it's hard for it to heal. But if you can create some stimulus that promotes angiogenesis or the formation of blood flow to that area, you can then get the healing cells there and cause some repair, or at very least pain relief.
Mhm.
And so, yeah, I think the technology is coming. It's very advanced at this point. And the more people that have it is better, because that gives, again, access to people. But for right now, skilled places like here and you and your team have been getting great results. And that's what patients are looking for when, everything else has failed them and there's no other option. This is a great thing to try.
Mhm. I think the one point that you made was like, with pain, tissue does shut down because that's, again, I always use an analogy. When you touch the hot stove one, you learn not to touch it again. So your brain literally always remember every single pain you go through, and it's going to do its best to just shut everything down so you don't feel that pain again.
Right.
Unfortunately, when you do that, you have weird movement pattern. You start moving awkwardly,
Yep.
and you learn to compensate really well, where it's going to create other problem, right? Because you don't have. It's almost like if you build a house and you have a good foundation, the house is going to be off if you keep going up higher and higher and higher.
Yeah, exactly. And a part of that is too, so, the traditional treatments in either orthopedics or sports medicine, right? Oh, just put a little steroid in there and, make sure, you feel better. That's fine for acute pain, but
Mhm.
this is the next level. This is where we're going to try to reinvigorate that area and promote healing and repair of it. Where, there's a time and place for certain older modalities, but I think this is the future where, like you said, there's almost no downside to it. It's outside the body. It is relatively painless when you're doing it. And after a few sessions, if you have significant results, then, you know, your rest of your modalities, right? Strengthening, rehab, performance, all of that gets better once you've fixed the problem.
Mhm. Yeah.
So,
What's cool is that too with the shockwave because people don't think that when you do any athletic event like either throwing, swing a golf club, running, like those muscles get fatigued and they get shut down, right? Because
yeah,
there's also a pain pain point with that. So we love just doing that for recovery.
yeah,
There's one research that our colleagues that you and I know, Dr. Monaco sent over to me
yeah,
of shockwave help elicit stem cell response in ACL graft.
right,
And as soon as I read that, I'm like, okay, we need that
right,
right then and there because if you can get the graft to turn
right,
faster and stronger, like,
yeah.
oh my God, that's you're I'm like in my head, I'm like, I'm hurting stem cell.
Right. And that's exactly it. That's the coolest part about it is even in the surgical patient, even in, where you're hoping healing is happening because of something that was done in a surgical fashion. If you can promote healing and get people back to their performance level prior to or even better than prior to the injury, that's huge. Whether you're a little league or a professional athlete, if that shutdown time, that rehab time is so much less with something minimally invasive like shockwave repair, I think it's huge. And what we're starting to understand is how these stem cells and other cellular responses occur. And that, I think, is what's so interesting about it. And as a medical doctor first, now a surgeon, it's really cool to try to, study and investigate the cellular response, the physiology behind all of it, because if we don't understand the basics of it, then it's hard to promote it, or understand how to tweak things in the future too. So yeah, similarly with platelet-rich plasma, or PRP, right?
Mhm.
We have a lot of current data out that shows that's beneficial for tendinopathy and chronic tendon issues. But more recent data, again, if you do that and add in shockwave, the results are even exponential in some, anecdotal evidence. So it's very cool to see how something so simple in a 10-minute treatment can actually change how your body is reacting.
Mhm.
And that to me is like, there, that's the key to the future, I think.
No, it's unbelievable, man. Because again, we're fortunate enough to to work with like athletes at a different level. So as soon as like people start asking like, should I get cortisone shot? Should I get this and that? I always say recommend, hey, is PRP an option? Because I do think if you do want to heal,
Right.
that's a really good way to get going.
Yeah. And so that's the other thing too, is, if we can pair all these modalities, right? So there's a time and a place for certain injectable options, a time and place for others. But if we're talking about healing, platelet-rich plasma and getting your cells and putting them somewhere and trying to activate them and cause a cellular response is, I think, the future as well. Now, a lot of studies that are out recently have been showing a lot has to do with platelet concentration, and we're working on our protocols to make sure that you're getting the best product.
Mhm.
But if you're just talking about the science of it, it's interesting to see. You reinvigorate the area with an injection with a needle, and then jam pack the area full of cells that are going to do something, like it's the biologically active things. And so I think PRP has a real big time and place. Um, and you see it, a lot of these studies happen at the professional level because cost isn't an issue,
Mhm.
right? So we see a lot of the NFL players getting these, even in routine knee surgeries. My partners will put in some bone marrow aspirate concentrate and help, because the studies that have been done recently show faster healing. And all of this is to get people back quick,
Mhm.
whether that's to play in a big game or next season, or even just to get back to their profession. If they're a painter, right? You make your living by doing this. If you
Mhm.
can't move your shoulder, that's huge. So for how long after any kind of intervention that you're going to be shut down, that's, food on your table if you're providing for a family. And so all of this is an effort to get people back to full recovery.
Yeah, and I think it's a combination of things. That's what I love. Because sometimes when people come to us, we never tell them like, "Hey, this is the one thing that's going to help you." Like,
Right.
no, it's a combination of things, right? We're talking about like lifestyle changes, right?
Yep.
We're always asking people like, "Are they sleeping? Are they stressed? What are you eating?"
Yeah.
Right? Because
Absolutely.
that's something. And what I love about what you say is like you're a primary care doctor first. So,
Yep.
can we talk about how you assess someone like lifestyle and how that can impact their healing ability?
Absolutely. I mean, so that's one of the biggest things that I think is different between, traditional surgical orthopedics and then doing primary care, where we just work together so well, especially in a group that kind of understands what each other does. When it comes to my assessment, I always take in, I've just been trained this way, is to always take into account what are the other factors at play here. Because we know through the studies of genetics or epigenetics and epidemiology, even, there are certain people that heal better than others, right? So, in a very simple example, someone that presents to the hospital has an infection. If they're diabetic, that wound is going to take much longer to
Mhm.
heal, right? And it's going to be a lot harder to get the infection under control. And so, if I'm similarly treating somebody's frozen shoulder, for example, right? One of the first questions I ask is, "Are you diabetic? Like,
Mhm.
how did this happen?" Because we know with people with certain endocrine disorders, frozen shoulder is more common. So it not only helps me get to the right diagnosis, but it also helps me understand the other factors at play that may, you know, need to be addressed, right? So if you have wildly uncontrolled diabetes, I'm going to say, look, we got to get this sugar under control. Otherwise, not only we have a hard time healing, but frozen shoulder, things like that all come into play. So for me, even once we get something under control and doesn't hurt anymore, then we shift gears. Okay, how do we prevent this from coming back?
Mhm.
And what else can we do to prevent other things from hurting? So weight loss, diet and exercise, healthy eating, promoting, less inflammation throughout the body versus, some, toxic foods that change metabolism, cellular composition, and the rest of that. So there there, I think, should never be a situation where you're looking at an individual and saying, oh, well, you're here for your shoulder. You're here because you have pain, and there's multiple factors that play into your shoulder pain. Sure, there might be an acute injury or not, but I need to understand who you are as a person and what your total composition is, that brought you to this point in your life, and where we're going to go in terms of your goals and how we need to get there. And a part of that too is just simply caring, like, these are somebody's family member, right? This is somebody's sister or brother or mom or dad. And if you treat them like that, I think, you look at the whole picture, lifestyle, modification, all that, because you want the best for them, 5, 10 years from now, right? Not just, okay, your shoulder feels better, see ya.
Yeah.
Right. So yeah, that's huge for me.
Yeah, I mean, I love that you touched on that. Like the one book I even have here that changed my perspective in medicine is Outlived by Peter Attia, and he's always talking about, like, early intervention as far as like early screening, but like looking at your body as a system,
Right.
like as an ecosystem of how one thing interact with another. The one thing I've been kind of obsessed with, because my mom, my mother-in-law, they're both postmenopausal now, and I always think about, like, I always ask them for like their bone density scan. I always ask them for like full panel blood work.
Right.
And I just wrote a long email about this like 2 weeks ago, talking about, like, if someone's pre-diabetic, the disease process has already begun a long time ago.
Right.
So to be pre-diabetic, it's not even like a yellow flag. I would make that a red flag.
Exactly.
Because you're pre-diabetic. You're like one donut away from being diabetic.
Right.
Diabetic. Right.
Yeah, exactly. And that's the thing too, is, if we shift the focus to more of a preventive model rather than a treatment model, I think we take a lot better care of people. So that pre-diabetes for me triggers the treatment. You don't wait and say, we'll just watch it, right? Something has to change at that moment. And for me, if someone is in the office or asking me, in the hallway or wherever for help, they're already ready to make the change. Like, some of it might be hard and need encouragement, because it's not going to be an easy road for everybody. But most of the time, if I'm being asked for an opinion or help, the initiative is there. I just have to help, steer the boat, right? The patient will ultimately drive it, and take it from where I tell them to go. But I think if you got the blood work done, that means you care. So I should help you do something with those results, for example. And the same is true, on a physical level. Personally, I think where it really shifted in my mind was the birth of my two boys. I have a 4-year-old and a 1-year-old, and I I want to be able to bend down and pick them up. I want to be able to run the bases with them, right? So I wasn't always the most fit, and still not, right? I got a long way to go, but I'm starting now, because I know in 10, 20 years from now, I don't want my knee to be killing me, or to be, so overweight or short of breath that I can't keep up. And I find a lot of people, even if they're figuring this out later in life in their 60s or 70s, they want that freedom, whether it's being able to walk out of the front door without pain, like they used to, or just to preserve it, drive their car, bend down and pick up their grandkids. There's something motivating them where it's not, it is about the pain, but it's because it's limited them in a way that is emotionally triggering. So it's almost something where you dig into their story a little bit. It's like, well, you know, I want to play golf, or I like to go fishing, or, I have to babysit my grandkids now and I got to pick them up and my elbow hurts every time I do it, right? So if I can get them to be able to do that and help along the way, whether that's shockwave, PRP, a good referral for physical therapy, steroid if it needs be, Toradol, whatever it is, it's a part of this process that, again, oftentimes isn't surgical. So if they go to see somebody and doesn't, I don't want anybody to feel like, oh, there's nothing for me.
Yeah.
Because there usually is something.
Yeah, my every time I talk to my patient, I always say, like, surgery is always on the table.
Yeah.
Right. It's like, let's do everything else before you get to that point.
Yeah.
Right. And again, I've been married with my wife for 4 years, going on 5. Been together for going on 15 years.
Yeah.
And it's like, when you get into a fight, like, people always like, oh, well, this is not going to work. Well, like, if you look at the divorce, not to go off tangent, but you look at the divorce rate in this country, it's like 50%.
Yeah.
So that's always on the table. What about just talking it through?
Right.
What about just like going for a walk? So, and like I think we're so extreme in our focus sometimes.
Yeah.
Where they think like it's an all or nothing approach.
Right.
And if you go to surgery, you still have to do work.
Yeah.
Afterwards.
Exactly.
Yeah.
And there's still that non-operative treatment, right? So you do the operation, but there's still all the other stuff you can add.
Yeah. And I think that the way the current medical system is fixing the boat while we're rowing.
Right.
Which is not really, it's not possible. You're just taking the water out of the boat at this point.
Yeah.
Where you and I were discussing, like, let's actually repair the boat before we actually set sail.
Right.
That would be a way better, it would be a safer journey.
Yeah.
And it will be a more enjoyable journey.
Right.
Because at the end of the day, you hit the nail on the head when it comes to freedom.
Yeah.
You know, people want to have time freedom. They want to have, financial freedom. They always want to have physical freedom. But, unfortunately, people really focus on a lot on, financial freedom. But, I talked to my team about this last week about this $150 million wedding. I don't know if you pay attention on it. It's like this billionaire from India. He's having this wedding. It's $150 million. And it's like going on like a week of two span. He is, I think, late 20s at most. He is around 400 pounds.
Wow.
And he is having a hard time walking and difficulty breathing.
Yeah.
So to me, when people always say, well, being healthy is expensive, like, yes, if you wait for your body to fall apart, it's absolutely expensive. Yeah. But if you take and you start today where like, all right, I'm not going to have soda, I'll have water.
Yeah.
Hey, I'm probably not going to eat that donut. I'll eat something else, right? It's all start with little micro action.
Exactly.
In order to really have a payoff in the long run. Same thing, if you invest in the stock market, right? That compound interest is going to take care of itself.
Right.
I think this goes the same way with health.
And that's the thing. I think you nailed there the compound interest analogy. A part of it is society wants instant gratification, right? So, just give me the medicine. I'll just inject it. I want to lose 30 pounds. Okay. Or, just do the liposuction, right? It would be faster and less effort. But if we want a long-term result or an actual change, and why lifestyle change is actually better than any other term, I think if you'll see, and most people would see, if you invest up front a little bit, stepwise, each day, working towards a goal, you'll be way happier and better off physically, mentally, financially, than if you were to just try to take the shortcut. Because you might get somewhere near your goal, but at the end of that day, you might realize, wait, that's not actually the goal. There's so much more that I wished I'd get if I didn't, maybe make some bad decisions or shortcut decisions.
Yeah.
But I think it's all about the mentality at the end of the day. But again, I trust in humanity in general, or in people, that they're inherently wanting to get better, and they showed up at the office or in your clinic, and they're there asking for help. And then, as long as you give them the ideas and the tools and the direction, ultimately, most people will see that, there's a lot still to do. And none of this is really, to talk down on the surgical intervention. Like, there are certainly cases where, you know what, this should be surgical sooner rather than later. And there's definitely that. And I think, my partners would agree, there are surgeons, right? They're the guys that love doing surgery, but plenty of times they'll try to talk their patient out of that unless it's needed. And that's, I think, what makes not only a good surgeon, but a good team, where, me and you will get calls from surgeons and say, hey, look, this could be surgical at the end of the day, but let's try everything, or get them ready for that surgery. So make sure everything else is strong so that afterwards they're ready to go, rather than starting from here. They're starting from here, in their recovery journey.
Yeah, I think every time we get someone that's pre-op, our main focus is to set expectation and also prepare them and say, hey, here's what your routine going to look like now and post-op, right? So that way they know, again, we use the term lifestyle change a lot on this podcast, but if you have to realize that to get to the thing that you want, and you're not having great success right now, something does have to change.
Yeah.
Right?
Exactly.
So like if you are going to get surgery, obviously, like, you did something that could have cost you to get surgery in the first place, so we have to change that. Right? And I think all in all, the message we're both trying to say is that it's changed for the better, not for the worse. And then I always say this to my team is like, good thing happened intentionally, bad thing happened automatically.
Right.
Right. So when you
Yeah.
have bad health, it's kind of just happened automatically. Like, I lost my dad 4 years ago, and that just happened automatically, and it just came out of nowhere,
Right.
which got me on this journey of just like, yeah, I'm a physical therapist, but because we get to spend a lot of time, just like you spend a lot of time with your patient, we would love to know the full story of
Exactly.
what is this injury telling me about their bodies.
Right.
And I think what's cool about what you get to do is, you alluded to earlier, like some guided ultrasound stuff, right?
Yeah.
Because that to me is like, we get to see how people move on the outside, but you actually get to see how they move
Yeah.
internally. So like,
Yeah.
tell me a little more about
I
that.
love ultrasound. I was heavily trained in fellowship to do lots of different things with ultrasound, not just, injections and things, but dynamic scans. So, if I do an exam and I'm like, well, there's something going on underneath, the skin there, the rotator cuff seems to be getting pinched, for example. I could put that ultrasound on. And what's better than an MRI is I can move you while I'm looking at the picture, right? Everyone knows if they've had an MRI done, don't move, be very
Yeah.
still, don't move. If you move, you ruin the picture, yada yada. But a lot of the stuff, even if it doesn't show up on MRI, it can be seen in a dynamic scan. So I'll put the ultrasound on somebody's shoulder and have them do the motion that hurts and watch as the tendon moves and pulls on its bony anchor point. And if I see it bunching up or it's thick or it's getting pinched, boom, right there, you have instant visual feedback. And what's nice is the patient's right here with me looking at the same screen. And so as they're moving, they start to see it bunch up on the screen, for example, or a tear comes into view and they say, oh yeah, right there, that's where it hurts. And they look at the screen. It's this whole nother level of perception where you get this extra part of your physical exam to kind of match with something visual. I think that's wildly impactful to not only the patient, but for me to say, hey, look, I'm pretty confident this is the problem, and this is what we need to do. And I'm going to direct that, with a super high level of, certainty.
Mhm.
Likewise, too, if we do ultrasound and we see the pathology right there, you can then guide something to that area, for example, a needle or a special, handheld device, and take out the problem. So if there's a calcium deposit in there and you see it's in the way, and say you've had a steroid shot and it only helped a little bit because the calcium deposit's still there,
Mhm.
we can go in there, break it up, and suck it out. And that I think is way easier as a first step, especially than going in and having a major surgery that means 6 months of recovery, where we can do it in probably 6 to 12 weeks.
Yeah.
So the other thing is too, sometimes on your end, right? You've gone through everything, how it should be done, and you just hit this plateau or this wall of recovery. It would be helpful to see like why. So you throw an ultrasound, you see a calcium deposit, boom, that's why. There's only so much that the patient can push them through in terms of strengthening and rehab if there's an objective, lesion or structure in the way.
Yeah, I mean, when the way we treat it, we always just look like, all right, is this a mechanical problem? Is it a neuromuscular problem?
Right.
Is it a motor control problem? Right. So, for, like what you point out, if it's a mechanical problem, when we can physically change the anatomy, the structure of it, that's something which warrant a procedure.
Right.
Right. So to make sure that the structure itself can move freely.
Yeah.
Right. But now, for us, it's like, now that we get that structure to move free, now how do we train the body to appreciate that new range of motion? How do you control that, right? How do
Yeah.
you incorporate that new motion into correct mechanics,
Yeah.
right? Because all of that has to be incorporated.
Yeah.
The best way I like to explain it is like, you got to fix the hardware if you have a computer.
Yep.
Then you got to update the software.
Exactly. Yeah, and I think a part of this too is people then learn to compensate and just kind of deal with it because life must go on, right? So if you can't, bring your arm past a certain distance, well, then you move your whole rest of your body, right?
Yeah.
And you throw out your back, your rhomboids, the rest of the structures get irritated. You do that enough times a day. Then sleeping, forget about it, right? You got to find a comfy position, put a pillow under places where there shouldn't be a pillow, throw off your pelvis, and it's all one big kinetic chain, right? From the head down to the toes. So like you said, if I, for example, take out that calcium, now I need the rest of it to be done, right? Got to fix the rest of the neural, muscular connections, the biomechanical, strengthening and conditioning after that. Which is why I think our team approach is so essential. There isn't, say, one component that we can just leave out. Whether that's surgical, non-surgical, minimally invasive, or just, lifting weights, right? Something has to be put in together with the other components. Otherwise, you'll have some imbalance.
Nice, man. So I want to kind of tie this back, this podcast, and just kind of wrap it up. So obviously, you mentioned your father, two boys. So how have your lifestyle changed? How have your perspective changed now that you have two little ones to care for? Because a lot of listeners on this podcast happen to be parents, and they tend to have a hard time, putting themselves first on the driver's seat. And we always say, like, healthy kids need healthy parents.
Yeah.
So like what are some advice that you can give to other parents, especially you working, seeing a lot of patient times, it's as busy as they come.
Yeah. So believe it or not, I've never exercised more in my life than now, and I'm probably the busiest I've ever been.
Mm-hmm.
And that's a hard hurdle to even wrap your mind around, especially as a new parent. For me, I have a 4-year-old and a 1-year-old. If you had asked me back then, like, how could you ever find the time? Like, you just simply don't.
Mm-hmm.
And often I still, I feel for people who don't have the time, but honestly, I do find it hard to believe that there isn't 10 to 15 minutes anywhere in your day that you could do something physical to get your heart rate up and better yourself. So for me, it's just having something on my phone that reminds me each day that passes that I don't do something, it doesn't fill in. And so I need that kind of motivator. But once the kids are asleep, as tired as I am, I can do 10 to 15 minutes. Most of the time, 20 to 30, that's my goal. But if I just have no gas left, even mobility or stretching, something, anything that's going to be, physically beneficial, mentally beneficial to just release. It's your time, whether that's waking up extra half hour early, 5 o'clock, 5:30 in the morning before the kids, or at night when they go to sleep. And then once you get into the routine of it, it just becomes a part of your life that you don't want to not have. Just like, sometimes it's turning on Netflix and kind of, chilling out. This becomes that same thing for me, and motivating at the end of the day. I have to keep in the back of my mind, being there for my kids, being the healthiest I can be for as long as I can be, making sure my health is in order, and that my overall lifestyle is sort of at least what I preach.
That's great, man. I love that. Just leading by example. Last question. Obviously, if if this podcast make it far for the next 18 years, and your son happen to listen to this, what is the message you want to send to them?
Oh man, that's deep.
Yeah.
If you guys are listening to this in 18 years, just know this is all for you.
Oh man, that one got me. That's a great one. I love that. David, thank you so much for your time, man. I really appreciate your coming on, just sharing your passion, and I think I can feel it. The listener can feel it, how much you care for your patient, and you're doing it for the right reason. And again, that's why we work well together.
Yeah.
Right, because it's hard for me to talk to another healthcare provider that think the same way, because all we're trying to do the right thing, and sometimes we do get uh bombarded, not bombarded, maybe chained down by the current medical situation, but rather than just complaining about it, we're trying to do the right thing each and every day. So I appreciate you for doing that each and every day.
It's mutual. Thanks for having me. And I look forward to just persevering, and ultimately, like, for family, for patients, we're doing the right thing to try to help people. And I think despite the hardships on both the patients and our end, I think we got a lot to be excited for in the future.
Great. So when a patient is listening to this, where can they find you?
So I'm with Academy Orthopedics Group. We're located mainly out of Wayne, but we also have other offices in Clifton, coming in Montclair, West Orange, Morristown. Academy Orthopedics. If you were to look us up, find us online. Always reach out or ask you.
Yeah.
We'll be able to get people in quick and take care of them, and do the best thing for them.
Great. So I'll put everything on the show note, and then that way they can reach out to your office directly, get some great care. I mean, shout out to all the other partners there, Dr. Celia, Dr. Pierce, Dr. Festa, great guys. So, again, thank you so much for your time.
Oh, thanks for having me.
You got it.